Also tonight, Lyme disease. It's spreading and spreading fast. And this summer, it's expected to be intense.
Take a look. This map from the Centers for Disease Control speaks volumes. That blue highlights the spread of the disease between 2001 and 2015. As you can see, the Northeast is ground zero. And these guys are directly to blame. Yes, we are talking about ticks. What you're seeing here is a black-legged tick. It's only about the size of a sesame seed, but the impact on your health can be immense.
And now is the time to take action. Tonight, our Paula Suro has important tips to protect you, your family, and your four-legged friends.
At one point, I was like, why is it itching so badly? And I pulled my sleeve up, and there was a tick on there.
An excursion through the woods in Ithaca turned into an itchy nightmare. Sherry Burns finding a tick inside her arm 2 years ago, needing tweezers to pull it out.
It was really scary. And having that thing just, engorged in your arm.
A surprise for Sherry, who was covered up wearing a jacket while hiking in the woods. But the scare just didn't stop there. The next day, her husband finding one on his back.
This was in pretty far, so I had to really dig it out. I used the tweezers, but then I had a needle.
So they rushed to immediate care to get preventative antibiotics, only after finding a third tick on her dog, Mr. Pickles. But thankfully, it turns out they were not one of the 3,252 confirmed cases of Lyme disease in New York State in 2015, a jump from the 2,853 cases reported the year before.
You want to come up?
Veterinarians like the one Mr. Pickles went to see say it's important to check if your dog gets symptoms of Lyme disease.
Fortunately, only about 5% of the dogs will come down with clinical Lyme disease, which is manifest by swollen joints, fever, not eating.
And to make them feel better, Dr. James Albert, a vet for City Creatures Animal Hospital, says dogs could get 4 weeks of treatment with strong antibiotics.
It's not fatal, but it certainly doesn't carry the same risk factors or morbidity, if you will, as it does with people, because when people get Lyme disease, of course, that's almost like having MS.
Doctors say the best way to avoid getting Lyme disease, especially in a wooded area like the one Sherry was in, is putting on insect repellent. In Buffalo, Paula Suro, 7 Eyewitness News.
Thank you, Paula.